Hey everybody, my name is Dylan Van and I am the Vice Chairman of the Pinellas Youth Advisory Council. And so we've kind of over the past few months been organizing and trying to put together a mental health fair. We were originally going to do it in person at the SBC facility that they have there. But we have decided to go virtual now due to the coronavirus pandemic. And so we've kind of put together three or four sessions of 3 or 4 different topics. We're going to cover today the anything revolving around COVID and the effect of being quarantined on your mental health and that kind of thing. And so we're super happy to have you guys today. And we'll be doing this every Saturday for the next 3 Saturdays. And we'll be talking about the LGBT community and suicide prevention. And also drug abuse. So all of those things are things that we're going to cover in these sessions. We'll be posting the recordings on Mental Health Monday. And so that's going to be kind of our mission, and to help better the mental health of youth in Pinellas County. So we've brought on Matt Fahey today, and he's going to do a great job and kind of lead us through the ins and outs of the way quarantine can affect your mental health. So take it away.
All right, thank you, Dylan. Matt, I'll stop sharing so you can share your presentation.
So that you do. Hello. Can you hear me? Okay. My name is Matt Fay. I'm going to be going over basic mental health, things you can do, things you can't do, and what will most likely help. So we'll start out with who am I? I'm Matt Fay. I'm a licensed mental health counselor in the state of Florida. I run a company called Heroic Health Group. I'm also the vice chair of Pinellas County 4-H Association. Let's see. Kids want to know a little bit about my background and the background in the field that I'm in. And so as far as mental health is concerned, there are a few different areas of education. The word counselor actually means a few different things. I'm a counselor, I'm a licensed mental health counselor, and that is a 2 years master's degree on top of a bachelor's degree. And then it is 2 years of field work being supervised or the number of hours necessary to get that done. And then you can go on, get a job and work without supervision. It's still good to collaborate, but that's the course track I took. There's licensed clinical social workers. They have a track that's very similar to the one that I was on. And the difference between the two is they actually help a person not only with their mental health, but they help the person get in and out of the programs that they need. Like, I understand that and I can help a person do that, but I generally will guide them over. My training was more in actual working with the person's mental health strictly. Then there is psychologist and psychiatrist. A psychologist is, I believe it's a 3-year degree on top of their bachelor's, and a psychiatrist is a medical degree. So they are actually a doctor and they can prescribe. So it's very different. And then the other one is basically they do tests. They do the test assessments and they can do the same job I do. And it's really about economics. So, and time. So different degrees have a different amount of time they can spend with their clients because of the economics of the situation. And so my field's actually one of the newer ones in that. And it's a lot of fun, and I get to be a helpful person to our community. So I'd encourage you guys to look into it. All right, here we go. So first question really I want to tackle, what was asked was, what are some of the statistics about the coronavirus? And the reality is it's just so new. It's a novel virus, right? That means it's new. And there just isn't a lot out there yet. Now, that said, I did find a bunch of research about making these surveys and data collecting, right? So we're starting to collect the data on the effects of our mental health that COVID's causing. And now I just want to cover really quickly that data is only good as the set that you're collecting it from. And in this case, like most case, there's inherent bias. And the bias in this one is, you know, when they called around and they got the people to volunteer, they got mostly white males, bachelor educated or above, right? So that is not a reflection of our society as a whole, but it was a good place to start to make your survey to find out how people are doing. It's called a measure. So they're measuring it. They're measuring your anxiety. Now, they tested it and they proved they had a good way to think about it. And that is they ask you a bunch of questions, you answer the questions, self-report, but then they're taking a look at how you're answering about your physical health. And so they're weighing your physical health report versus what you say is going on with your mental health, right? And if those two don't line up and you're showing me a ton of symptoms of anxiety, then I know you're not reporting the full truth about how the anxiety and the coronavirus is affecting you. So you can weigh those out and balance out what the outcome is. And so that's what I was finding. It looks really good. I think the data coming forward from that is going to be pretty awesome. And hopefully they can go forward and do some more researching and bring in the other communities that are necessary to make a full report. Okay, so what can we do? Educate ourselves with the best that we can find, right? CDC, I would encourage everyone to go there. Their page is amazing. I found tons of stuff on it that are very helpful. There's stuff specific to other questions you guys asked me about going back to school. They have a matrix survey to go through and say what the dangers are that you're willing to, you know, look at before you go to school or before your parents put you into brick and mortar. And it's really comprehensive. It's a great little way to look at it and go through the data that they're presenting in order to make that decision more informed. So, you know, during this, we need to continue to educate ourselves, to go to good sources. It isn't your uncle's brother, cousin telling you they found this on Facebook. Don't do that. I want you to look for real data, okay? Data is important. So as the data comes out, it's going to change the details, right? It's going to change what we know. That's okay. That's how science works. Just be prepared to know that it's going to change as we go, and that's okay because we're going to find out more. All right. Now, if we were talking about the thing about quarantining, right? So your feelings are valid. You know, these things that are coming up, the frustration, the boredom, the fear, all creates anxiety and depression. And it's very normal for us to go through this. We as a species have survived for a very long time. And we've made it through pandemics before, right? This is new to us, but if you look over at Asia, they jumped on the masks, they jumped on going into quarantine a lot faster because they've been through this a few times in the last few years. So we have the adaptability and we know that's within us. So again, with the idea of the data, I want you guys to pay attention to the idea that some activities are more risky than others. And if you look at what they're putting out there, this is a great chart for it. There's many more out there, and they're telling you what you can and can't do based on the idea of risk. So you can go to the high risk things, but just take more precaution. All right. So as far as strictly anxiety goes, it really depends on what your quarantine situation is, right? Behavior is always relative to what you are going through, and your external showing of that behavior is also going to vary, and it's going to be acceptable or non-acceptable depending on where you're at, and that's okay, right? That's what we have to work on, that we're at an appropriate level of expression in the place that we're at. That is our goal as people, and sometimes we don't always meet it, and that's okay too. Just try to own it and say, I'm sorry, and move on. So what is your quarantine situation? You know, like, are you able to stay at home, work on hobbies? Are you reading? Is the person all the way to the fact of maybe being in hospice and an ICU? So these levels of anxiety are going to be very different depending on where you're at in the continuum right now. So it's an honest way of looking at it. So I'm not going to sit here and tell you for everyone that it is going to be the same. It is not. And at some level it's different, and that's okay because you're just at a more severe place, right? It's okay for that person to be more scared than the person that's just at home and no one's sick in their house compared to the person that's in the ICU. All right, so I just want to talk about wherever you're at in the continuum, your feelings are valid and you have a right to have them. It's okay, right? It's how we express it and how we control it that matters. As far as help, the one thing I want to stress here is really pay attention to limiting your social media and your news consumption. I don't want you to be uninformed, but there is such a thing as becoming overwhelmed by the information. All right. Grief and loss. Now, I want you all, we're gonna have a little breathing exercise in a minute, but I want you all to understand that I've been working with all of my clients and everyone I talk to when they ask me about these things, that we've all lost the normalcy of the way of life that we had before. The world that we were in before COVID-19 is very different than the world we are in now. And we all know that parts of that world are not going to come back completely. Like, our society is going to change from this and is going to be different afterward. So it's okay to have feelings of loss and grief. Matter of fact, it's appropriate. You know, it's incredibly important to allow yourself to go through that process, because trying to act like it isn't happening and moving forward is actually going to cause more anxiety, right? So honest assessment and process is the way to go. So one of the things I was hearing from you guys is that you felt a big loss was the social interaction, right? And now that social interaction could cause you to get sick, right? It puts you at risk of exposure. And then on top of it, that social interaction also puts you at risk for inappropriate behaviors that some people are expressing at this time, right? So there's multiple factors going into that. And it's okay to feel that, to take the knowledge of that and process it through. So one of the things is it's hard to look at this because the people that are often expressing these negative behaviors we're seeing are the adults that we all should, you know, be looking up to. Some of these people are figures in our community that it would be nicer if their behavior was a little bit better. So they're not making the best examples, okay? So everybody's under stress and everybody isn't gonna make the right choices right now, okay? Human beings are very resilient. We've made it through so much as a species, and we tend to have a little bit of survivor bias in our situation. We have an amazing ability to just normalize where we're at and to adjust to the hardship that we're facing while we're in that place. And that's useful. That's helped our species to survive. In general, when we look at the future, though, from where we're at, we overgeneralize the danger, and that's good because that adjusts us to being ready for the future. It is a great survival technique, and that's why it has been with us this whole time. The problem is that we tend to scare ourselves when we look into the future and we see a lot of doom and gloom. Okay, and when we scare ourselves in the now, because we're looking in the future, we then kind of create a little feedback loop of anxiety, right? Because we're looking forward, we're seeing a situation that we're like, I don't know if I can handle that. That's a lot. And we feel it from where we're at and we have anxiety. And then that kind of feeds on each other, right? So that just increases that. The other part about this is that when you look into the future, your behavior, your emotion at the time has an influence and an effect on what you're going to see. So we're going to do a little experiment. And what I want you guys to do is we're going to take a deep breath, right? So deep breath all together. Let it out. And I want you all to imagine something that you really enjoy, or a moment in your life that brought great happiness to you. And I just want you to get it in your head. Really think about that, right? And now that it's in your head, I want you to think about 2 weeks from now and what your life is going to look like 2 weeks from now. Okay? You all there? Okay, now we're going to change up. Deep breath, let it out. Now I want you to think about something that causes you stress or worry. I want you to think about something that you feel like could destabilize your life. All right, you there? Now I want you to think about your life 2 weeks from now. Okay. It's a little different. It changes our perspective almost instantly because of the tone it sets already in our mind, right? We have control over this, and knowing where we're at when we're thinking about these things can stop that feedback loop, right? We can take better control of it, and we can change how we're seeing, and we can change how we feel now. All right. Oops. All right. So again, it comes down to what can we do, right? So we're going to talk a little bit about a CBT, which is cognitive behavioral therapy. It is the most proven form of therapy in the field of mental health currently, and combined with medications, it is very effective. So it's actually based on some older beliefs, and I'm going to talk about those. Didn't bring it up earlier, my bachelor's in archaeology, anthropology. So I'll always step back a little bit to our ancestors, right? So the first thing about this, in simple terms, is that we have to accept that we cannot predict or control the future, right? Our prediction is only the best as it can be, but we are not right, right? That is not what is going to happen. There are many changes over time that will happen. And most of what's going on in our lives is outside of our control, right? So if we're nervous and we're scared about the bigger things going on in society that we have no hand in, we are going to be scared. We're going to be in a bad place because we can't do anything to control it. And humans do not like to be in situations that we cannot control. So we're going to step into some little Greco-Roman stoicism, right? And it's not to be confused with the idea that it's a lack of emotion. That's an interpretation of stoicism that's not realistic. Stoicism values courage, temperance, justice, and wisdom. We all need a little courage right now, and sometimes to just get through the day. But you can temper your courage and not be reckless, right? The idea that we come together as a community and maintain standards and justice for each other and keep each other's safety in mind is also part of the Greco-Roman value system. All right. Now, you can work on how you feel by taking care of what you can control and learn how to separate the two. This is the fundamentals of Stoicism, right? You cannot control the world. One of the greatest writers in Stoicism is Marcus Aurelius. He was an emperor of Rome, and he lost a lot of family members in a plague. He lost all but 2 of his children out of 14, and he lost his wife. And it all kind of came in a very block period of his life. It was very short. And he wrote about how if he allowed it to affect him, he would not be a good emperor and more people would lose their lives. And so it was dependent on him to control himself. He could not control what it was doing to the outside world, really, and how the disease was affecting people, but he can control himself so that way he could make good decisions. So you can control your response to how you choose to process what is going on around you. You can choose to take control of your own actions. That's a big one. And doing that can reduce your stress, anxiety, and possible harm to yourself and those around you. So this is the biggest and the greatest good to our society, is to learn to take care of what we can, and what we can take care of is us. And that was why it was very popular philosophy in the Roman time, because they were a people dedicated to the state, right? Okay. So stepping back a little bit to the grief again, accepting where we are in, that we are in a place of grief, accepting the grief will make it easier to make those choices based on what you can control, right? So when we talked about earlier, the idea that our world has changed, accepting that loss will give you an understanding to kind of let go of the feelings that are caught up in there, right? It'll start you on the road to healing. And then you can start to make choices along the lines of what can I actually do, right? You can wear a mask, you can follow safety precautions, you know, the washing your hands. You importantly need to remain adaptable to changes. I said the data is going to change, therefore they're going to ask for different things along this timeline. Taking responsibility for your emotional state so that you can work to make a more positive behavior change in yourself. And it influences others around you. Okay. All right. So these are things that we can do. Breathing techniques are really important. So we're going to kind of go through these and incorporate this just a little bit now. So we're going to take a deep breath and let it go. Knowing your feelings of loss are valid. Worrying about the mortality is valid. You are no longer living the same life that you had a year ago. Okay? That's okay. Again, take a deep breath. Let it out. You can give yourself room to accept these things, and accepting the way you feel. Your feelings may not be the same as everyone's. Everyone's going to respond to grief differently, and it's okay. It's okay how it affects you, and it's okay how it affects them. Deep breath. Let it out. It's all right. We're in this together. We can do it. Okay. The biggest thing you can do to help yourself and others is accept the responsibility of your own behavior. Take care of your basics. This is what your primary care physician would say to you. This is anything you're going to read in a mental health or physical health situation ever. These are the basics. You always need to work on these, especially when things are bad. And when things are bad, people tend to walk away from these things because it's easy to, right? It is. So keep your basics going. Exercise. Make sure you're sleeping well. Look up good sleep hygiene. It can really help. Eat more healthy foods. Maintain your diet better. I understand having a little ice cream every night during the pandemic sounds amazing. Just don't have a giant bowl of it every night, okay? And try to maintain a routine. When we have a normalcy to our life that we can keep, it reduces the stress all around. So don't stay up all night playing video games every night. That might be a routine, but it probably isn't the best one for you. The other thing is don't withdraw and isolate, right? Don't pull away from other people. Even though we physically have to isolate from people right now, we have to quarantine, does not mean we have to emotionally, and there's a lot of ways we can still be part of our community. All right, so what can we do for ourselves? Again, you can keep in a better frame of mind. We're gonna draw on some Eastern philosophy now as opposed to Western European philosophy. And these things will help us in the idea that daily meditation or mindfulness are important. Again, we tend to look into the future or we tend to think about the past. And we either romanticize the past or we'll turn it into some type of land filled with horrors, right? That's like our mind doesn't have to remember the reality. It tends to remember more of what you're feeling. Again, when you look at the past and you're in a bad mood, you're going to remember bad stuff, right? If you look at the past and you're in a great mood, you're going to remember all the great stuff. That's just how we are. And it's the same way looking forward. You're going to see that depending on your mood. So In a lot of Middle Eastern philosophies, the concept is to be mindful within the moment. And that's what most of meditation is about. Meditation is about the concept that truly the only time you really have in your life, the only thing you really have is now, right now. One breath at a time. You only own that, okay? And that's why there's a lot of meditation in Eastern religions, is because looking into the future can scare you. Looking in the past can cause you to over-romanticize. But if you just focus on now and handle what's going on, it will generally pull your anxieties down and better prepare you for how you're doing. You don't have to do this as a meditation where you have to sit in the same space, although being still is cool. Some people just are antsy. I am, right? I do a lot of gardening. That's my meditation. It's kinetic. You can do a walk. You can do Tai Chi. You can do yoga. These are things where your body's moving around while you're clearing your mind. It's a kinetic meditation. It's just as good. It just works for different people in different ways. All right. And maintaining those social connections, because that's a lot of what I heard from you guys' questioning, is also tied into your mental health and the fact that your mood, again, matters. Man, music can really change where you're at. Make a happy playlist. Use it, okay? It's really important. Watch your favorite movies, get some online games going. I don't know if you guys know, you can go to Steam and play some Tabletopia with 4 of your friends. Any board game you can imagine, they have it right there in a virtual setting. I'm a big nerd. That's what Heroic Health Group's all about. Join a Dungeons and Dragons group. You know, that's a group of you and your friends having fun, right? Online, you can use a virtual tabletop. It's awesome. And you can use lots of forms of social media. You can have a watch party. You can use your phone as a phone and actually reach out and call someone. It's all right there. This is probably one of the easier times to be in quarantine as far as human history goes, right? All right. So it was a lot of, you guys asked a lot about what about going back to school? Again, we're going to step in a little stoicism for the moment. You guys have to control what you can, because you can't control everything around you. You can't control the situation. If your parents are deciding that you should go back, then that's what you're going to end up going back, right? You can state your feelings, but your ability to concentrate right now, whether you're at home or you're going into the school, is going to be lowered, because when we're stressed out, our anxiety levels go up, our concentration levels will drop, we'll become more easily frustrated very quickly. So do not just think you can sit down and push through the homework like you used to, or push through the assignment in class like you used to. It's okay. You're going to have more stress. Take breaks. Breaks don't have to be long. When you're in the break, take a few deep breaths, do what you need to do to relax. Take a break when you're at home. Don't just push through all your work at the same time. And what that does is it improves your concentration, which means the output of the work will be better, and it reduces your frustration. So you're not going to be like, oh, I can't wait to get this done. You'll be like, okay, I got to work on this. It's all right. Okay. The big thing about this, I'm telling you to take breaks. Don't procrastinate and just take breaks. Okay. You got to take your break, and then you got to go back to work. All right. Boundaries. We were talking about, like, what do you do when you go back to school, or what do you do when you're in public and you're trying to maintain safety and someone else is not? Or when you want to talk about how you feel at risk and you want to do it in a beneficial way to everyone. So face-to-face interactions may still be part of your activities, but you have a right to safety. You always have a right to be safe. Okay, everybody does. Your right doesn't supersede theirs, and their right does not supersede yours. Okay, we all got to work together for safety. So keep looking at data. It's going to change. Keep looking at the things that you can base your views on that are scientifically based. Okay? And when the first thing about boundaries at this point, you look at the data, and then you think about what you really want those boundaries to be. Like, don't just amorphous it. Oh, no, you need to know in your mind what those boundaries look like to you. That is very important in boundaries, and you can do this anywhere in your life. Everyone is different, so everyone's boundaries and concepts are going to be different, and that's okay. It's that we're going to come to a mutual place. So what's acceptable to you, work it out and write it down. It really helps to get it down on paper. Creating it in the real world, not just in our head, is an action that makes sense, right? So it makes the thought make sense when you write it. The Egyptians used to call that the magic of Thoth, the god of knowledge. So let's talk about a few instances. What about social distance and a walk with a friend, right? Is that okay with you? Or is that a boundary, hard no? You don't want to go in public. You don't want to do that walk. You don't want to risk them. You don't want to risk yourself. You might look at that situation because someone at your house is at risk. A trip to the store where people are not being serious about safety, right? That can vary because maybe that's the only store within distance of your house and your family doesn't have a reliable vehicle, right? So you're going to be stuck going to that place. But if you have the vehicle and you could skip that place and go to another one, see how the boundaries change depending on where you're at, what you can do. Your boundaries are your own and should be based on data and the precautions you would like to take. Right? You have a right to your own boundaries, and you do not have to change your boundaries. Right? You can keep them where you're at, but you can compromise to fit into a situation. But if it is too much, then you should disengage and maintain your boundary and figure out a different way to do it. Okay. And this comes down to authority, right? If you don't want to go back to school, but you have to because that is the system in place for you, determined by your family, then what can you do at that point, right? Because at some point, all of us are going to go through a situation where someone is not following the rules and that you cannot change it, and they have authority in the situation to take those risks, right? All right. If an authority figure refuses to use a mask and you can't force them to wear one, remember what you can control. You can voice your opinion. You can ask the person to stay away from you, like keep distance, right? You can take your own precautions, right? So you can wear a mask. Maybe if that isn't good enough and you know you're going to be around this person a lot, you can work at getting an N95 mask, right? Because that is going to protect you. So you can, mitigate the risky behaviors. If someone in your household, somebody asked about if you're quarantined specifically or if someone's sick, again, it's all about what you can do. Look at the data and make a plan that's best for you and your household. And then, work it out together. Talk about what that plan would look like and write it down as a family. That's the big deal, is write it down, have the communication in a place that everybody can see it, talk about it, and make it part of the real world. Use the magic of Thoth. If it's up in your head, everybody has a different interpretation. Okay, write it together and then interpretation will be closer to similar. Text it, right? All right. So the big one too was if you're in the community setting and someone's not following safety procedures and you ask them politely to wear a mask or to step back from you and they become aggressive or threatening, what do you do? What do you do? Right? You can't make this person change. Right? Their behavior might not be based on rational thought. Right? Some people might be in a really bad space and making bad choices, right? Maybe they did lose someone recently and they're angry and they're mad and it's coming out in ways that are not positive. So what do you do? If a situation arises where you need to use de-escalation techniques, here's some tips. You give the agitated or aggressive, threatening person physical and emotional space, right? So back up. Right? And if they're following you, politely ask them to stay back. Can you please stay back? I feel threatened by you. I would like some space. I'm trying to work with you. All right. Make sure you have an escape route, right? Do not have them cornered where they feel pushed in a corner, and do not allow them to corner you as well, right? And your escape route supersedes theirs, okay? You have the right to run away. And if you got to use it, use it. Do not engage them directly on what the behavior is, right? And do not try to change their mind to a contrary belief system. People tend to take that as a physical attack. The brain actually responds to that as a physical attack. Okay, they will become more defensive and aggressive. So this is the first things you need to, in that situation, do after you have space, is calm yourself. If you're showing them aggression, if you're showing them fear, if you're going into fight or flight, they're going to feed off of it and they're going to accelerate. Okay. Control the tone of your voice. Control the volume of your voice. Be aware of what body language you're using. Okay. Don't exhibit threatening verbal or physical behavior toward the other person, right? Do not get into a who's tougher in this situation. If they're not being stable and they're not responding to the situation in a way that everyone's safe, you don't have to fight them. You don't have to get into it with them. Be calm. Show no aggression. Exhibit your hands with your palms up, out, flatten your tone out. You can hear I'm already using my please be calm voice. Pay attention to the tempo you're using, because if you talk really fast, it doesn't matter if your tone's okay. Okay? You're still showing stress and they'll still feed off of it. So slow your tone. It's all right. And remember to use simple language, right, when you're trying to work with them. Now, if the discussion develops into where they're willing to talk with you and they're able to calm down, because anywhere in there, I want you to know, especially when you're using the right behavior, it's okay to be like, please calm down. I feel threatened by the behavior you're exhibiting. And I do want to get along with you. And I do want to work this out. That is a very positive message to send in this situation. And it is the correct message. Telling a person how you feel is okay. Right? And it helps them understand that you're a person and that they're causing that emotion on you. But the thing is, you want to use an I statement, right? You want to use, I feel threatened when you become aggressive. I feel threatened by the aggression, not by the person. I feel threatened because you are in my face. You don't say that, okay? You let them know that you feel that way by what's going on in the situation, not necessarily by them. And you take ownership of your own feelings. All right. Now, when it gets to the point that you can talk, like they have calmed down, they're talking, you can say and repeat back to them, paraphrasing. You don't want to use their exact words because it can sound condescending, but you do want to use a paraphrase of what they're saying. This is a good example. I understand you don't want to wear the mask and you believe you have the right to not wear one. I still feel threatened when you were angry and yelling. The policy here states you need to wear one while inside and are unable to maintain distance. If your behavior continues in this way, I will have to contact the authority. I do not want to do that. I want us all to remain safe and get along. How can we do that together? Okay, you're showing you're on their side. You don't want the bad thing to happen. How can you work with them? How can we do it together? Right? You're also shifting blame off on the policy, not you. Your hands are tied. This is just the way it is, right? When you paraphrase to a person, it really does express that you're listening. So that's the first thing. A lot of times they just don't feel heard and they're angry. letting them know that they're heard, but you still can't accept the behavior, but that you understand them, sometimes is enough to make the person go, well, yeah, I don't want to wear a mask, but since you heard me, I'll put it on. Okay. Now, if it doesn't work and they're still being threatening and aggressive, right? Disengage. That exit we talked about before, that's important to have. Go use that now. All right. In the situation, everyone's action should minimize the risk, yours and their included. The big thing before we go to the slide is to know that always follow through, right? Don't tell a person that if their behavior is like that and they continue it, that you are going to call the police and then don't do it. Okay, because maybe that person didn't get into the store, but now who are they going to aggressively go after in the parking lot? So that's somebody else that's now at risk. If that person was not able to do that for you, it does not mean the situation is over for the rest of the community. You've basically already done a mini assessment that this person will not change behavior and is going to continue aggression. So it's okay to follow through and call an officer and let them know. Now, maybe that guy gets in his car and he drives off and the cop wasted 15, 20 minutes to get there and to check out to make sure people are safe. That happens to them all the time. They're not going to be upset about that. They're going to be okay. They want to make sure people are safe too, right? And if the guy's still there yelling and screaming at people in the parking lot, then you did the right thing, right? Everything works out. It'll be much better. All right. So what can you do for others in this situation? We talked about what can we do for our teachers, what can you do for our friends. Understand we are all having a hard time, all of us. We are in this together. We can work together. Remember to give everyone the space they need to validate others' feelings, to paraphrase what other people's concerns are so they feel heard. And take this and share it with other folks, okay? We made it. So what do you guys have any questions for me?
Do you mind flipping back to that first slide with the level of risks for each activity?
Yeah. There we go.
Okay, thank you. I thought that was really interesting.
Yeah, it's nice to kind of see it laid out, right?
Yeah.
Yeah, and there's a bunch of them. This one just was the least busy for it to work on a PowerPoint. There's others that are much more comprehensive.
Okay, thank you.
Yeah, they really can help.
Mm-hmm.
Anybody have anything else?
Sorry, I had one more. And then for people who may be interested, do you do online sessions? Is that the way that this is working now? Okay.
Currently, yeah, I'm doing all online. You know, I would change that if somebody was in crisis or they really needed me. I don't mind going out. I've always been an in-community therapist. My early years were doing in-community treatment, and that meant I actually went to the person's house and sat down and did therapy with them. And yeah, so that person is still there in me. So a lot of times I'll drive, especially if the person needs it. But right now in COVID, everybody's just like, no, we want to stay safe. And so all my clients are like, online works for me. So.
Okay.
Anybody else?
If anyone has questions, you can put them in the chat too if you don't want to talk on screen, and feel free to unmute yourself or raise your hand. I want to see what questions you all had came up with before. So one of the ones that you all had come up with when we were meeting last week was, if we see someone that is struggling, what can we do to help them?
Okay, so if you see someone and they're having a hard time, you want to watch for what the signs of depression are, right? So the biggest one you're going to see is that they're going to withdraw. They're going to pull away from other people. So letting them know that you're there and you want to engage with them and that their depression or anxiety is not a burden upon you, right? Because that's one of the main reasons they're going to pull back as well. I feel like this and I don't want to upset or hurt my friends, right? They don't want to be around me when I'm like this. Okay. And that just makes it worse. Right? So let them know, you know, it's okay. It's okay where you're at. Validate their feelings. Let them know you still care about them and that it matters to you that you're able to do things online with them. You're able to interact with them on a normal basis. That's one of the biggest things you can do. You know, and like I said, you can kind of share what we were talking about in here. The ways to calm down, the ways to self-care. It's the same for them as it is for you. You know, and it's okay, absolutely 100% okay to ask a person if they feel like harming themselves or someone else. 100%. That is an okay question to ask anyone that you're worried about. And I understand that that feels weird, right? But it is absolutely okay to do. That is the biggest thing you can always do. If you're worried, ask them, right? Because guaranteed, if they're worried, they're scared. And if you ask them that, time and time again, the evidence has shown, they will tell you. Most people that are thinking about harming themselves are willing to share it if they are asked that question, right? So they tell you, yeah, I'm thinking about it. I'm thinking about harming myself. That's, you know, validate their feelings. Say, no, that this has been really rough for you. I'm sorry that you feel that way. What can I do to help you? And listen to them, all right? You do not have to fix it at that point. It is no longer on you either. You can be nice in the moment, but also let them know, I'm worried about you. I'm glad that you shared that with me. I have a responsibility to make sure that you're safe now. And I'm going to share that with someone that I know can help you with that, right? That is not data that you save and keep hold of, right? That's you reach out to a parent. If it's a kid, you reach out to a parent. If this is an adult, you reach out to another adult loved one that knows this person. You let them know that. And if you feel, not if you feel, always, all right? This is the thing about you ask that question. This is the hard thing about it, you ask that question. If you get that answer back, you have a duty to report it, okay? You can call a non-emergency line. You can ask for a CIT officer, that's a crisis intervention trained officer, to do a health assessment. You can get a hold of a mental health professional, right? You can get a hold of me. And what we'll do, the officer or me, is we will do an assessment. We will ask the person the same questions pretty much. And if, you know, they're honest with me, or they're honest with the officer, then we'll be like, okay, well, let's make sure you get some help, right? And that goes down to even crisis intervention. Sometimes people need to go into the hospital in order to make sure they don't harm themselves or someone else, and they can get some treatment. Maybe they're going to get a medication. Maybe they're going to be assigned a caseworker or a therapist when they get out, right? But 3 days is normally a period long enough to make most people to stop thinking about harming themselves, right? That's a calm down period long enough that when they go back into the population and they get the resources, the tools they need, they'll generally go on and get better. All right. So that is the biggest thing you can really do. Be there, hang out with them, let them know that what's going on with them isn't a burden for you and that you want them in your life, right? And if you're really worried, ask. Okay, it's okay to ask. Anything else?
So there's a question in the chat that says, what is the non-emergency number?
I got somebody looking it up, but overall for the county, you can just type in Google all the time. I do it because I don't have it on my phone, and it changes depending on where you're at in the county too. Like St. Pete has a different non-emergency number, and Largo has their own non-emergency number, and then the sheriffs have their non-emergency number. So it's still going to be answered by one of the 911 operators. Right? It just goes into the phone line, letting them know that somebody isn't about to get shot, right? They don't need to send the cops there immediately. And that way you don't end up with an officer that's heightened and alert and worried, right? You don't want an officer showing up worried and they're in a bad spot to talk to someone that's in a bad spot. Okay? So when you call the non-emergency line, it goes to the same dispatcher and let them know this isn't an emergency. This person's in a bad spot. I need a wellness check. Can I have a crisis intervention trained officer, a CIT officer? Because that officer is trained to go into the situation, no matter how bad it looks, and do the de-escalation I talked about earlier, right? And they know it at a very deep level. They're really good. I've worked with them many times to get a client out of crisis and into crisis intervention treatment. Do you have the number? Okay, so the number's in the chat. You can call that one. Okay, and those are, yeah, those are all municipality throughout the county. So it's very helpful to have those. I've done that while driving. I'm going to be honest. I've like been at a light, looked over, saw a little old lady. She clearly was not in a good place. She was soiled, right? So she'd gone to the bathroom on herself. She looked unkept, very unkept, right? That's a sign that this person is not in a good state. And she's just walking down the road in Largo, right? Gesturing, talking to someone that isn't there. That's another bad sign. And so I don't want that person to get hurt. I don't want her to walk out into traffic, but I also don't want to call 911 and have a cop roll up on her. So I call them that crisis intervention. I tell them what's going on. I tell them the street block she's on. I do a loop around to catch her again, so I can do the identification as best as I can for the person on the phone. And they're like, it was beautiful because they said, you're not the first person. They all just started coming in. We have 5 reports of the same person. There's officers on the way. So you'd be surprised.
One of their other questions was how to reduce anxiety. You mentioned it a little bit. Do you have like a resource that you recommend for maybe mindfulness or meditation or anything that they can do online?
Yeah, I think honestly the CDC has a ton up right now.
Oh, really?
They really, yeah, they've got it covered, and there's great links. Personally, I really like, you can pull decent YouTube videos. They got tons of them. So you can always pull some great videos down and kind of go through for mindfulness. Yeah, there's really good videos, and there's really good kinetic ones too. Progressive muscle relaxation. That's awesome, right? That's a really, really good one. Grounding exercises are good for if a person's in a panic state or in a really rough spot. They're very simple. They're easy to do. The easiest is called a 5, 4, 3, 2, 1. And it's just using your senses to calm you down, right? So 5 things you can see, 4 things you can hear, 3 things that you can feel, right? 2 things that you can smell, 1 thing that you can taste. So you go through those. And then taste, like we don't always have a lollipop in our hand or something. That's cool. You can imagine a taste. So lemons, right? Cinnamon, right? Our senses are important to the data process in our brain, and we're almost always caught up in them. So if you hijack your senses and you use a 5, 4, 3, 2, 1 and deep breaths in between the stages, you will get the brain flowing in a different direction. You take that panic in your fight or flight response, and you're like, hey man, there's no bear in the room. There's no bear. It isn't going to get you. You're safe. Right. So that's a really good one. Psychology Today, that's a really good place to go. It's a great place to find a counselor, and they're constantly putting up really good links all the time. So that's a really good one too.
Awesome. Do you all have any other final questions? And if they do have any questions afterwards, can they email you, or do you want to provide, I guess, your website to, if someone needs a counselor or anything like that?
Yeah, absolutely.
Awesome. Thank you.
Yeah.
Dylan, do you have anything else?
I am good, y'all. Thank you for coming, for everybody that is here, and I hope this was helpful. Matt, thank you so much.
Yeah,
You're welcome. It was great.
Thank you so much. And I will be, all right.